Hello, welcome to Health Talk with Dr. Toyin. Today we'll be discussing urinary tract infections. The urinary tract comprises of the kidneys, the ureters, the bladder, prostate, epididymis, and urethra. To give us a better understanding, we'll look at a diagram of the urinary tract. The kidneys are found at the top of the urinary tract, and they are connected to the bladder by tubes called ureters. There's a tube running from the bottom of the bladder which runs through the penis, which is called the urethra. In males, there's a gland under the bladder which is called the prostate. There are tubes connected to the top of the bladder called vas deferens, and these connect to the testicle on each side. Just above the testicles are a gland called the epididymis. As said earlier, infection can occur anywhere along this line. The female urinary tract has the kidneys in the top portion. They are connected to the bladder by way of tubes called ureters. The bladder connects with the outside world by a tube called a urethra. As can be seen, the urethra is short in the female, which is why they are prone to urinary tract infections. Urinary tract infections are commoner in women because they have a shorter urethra. Diabetics are also more prone to urinary tract infections because of the high sugar content in the blood and urine. Those with structural abnormalities of the urinary tract are also prone to urinary tract infections. Those with poor hygiene are prone to urinary tract infection. And this is important in females because those that clean the genital area from the back to the front are prone because without knowing they might be spreading feces to the urethral area. So how would you know if you have a urinary tract infection? Commonly you need to urinate more often, and when you do, there's a stinging or burning sensation. Small quantities of urine might be produced, and there might be blood in the urine. Things like constipation can lead to urinary tract infections because of the pressure on the bladder. Also dehydration, because the urine stays in the bladder and bugs now multiply. So that makes people prone to urinary tract infections. For a child that previously was able to urinate on their own and they suddenly become incontinent, it's important to check that they do not have a urinary tract infection. And also in elderly that become incontinent, it's worthwhile to check they don't have urinary tract infections. For some women after intercourse, they might be prone to urinary tract infections. Pregnancy also predisposes people to urinary tract infections. The tests you might need to do for urinary tract infections include a urine dip. And if the urine dip shows there is blood in the urine, it's worthwhile to repeat it after 1 or 2 weeks to ensure the blood has disappeared. If the blood has not disappeared, you'll need further investigations to rule out other causes of blood in urine. How can urinary tract infections be prevented and treated? Most importantly, you need to drink water and lots of water. As I explained earlier, dehydration can cause urinary tract infections due to stasis of urine in the bladder. Some studies have shown cranberry juice is effective in both treating and preventing urinary tract infections. For those that have catheters, this will need to be changed regularly and under hygienic conditions because it can predispose to urinary tract infections. You might need antibiotics to treat urinary tract infections. For women that are prone to urinary tract infections after sexual intercourse, they might need to take some tablets after sexual intercourse or to maintain hygiene by washing the genital area after intercourse. As I explained earlier, for females, it's important to clean from front to back and not back to front to prevent spread and leading to urinary tract infections. I hope you enjoyed this video. Watch as many times as possible. Don't forget to subscribe to my channel and share. And until next week, smile because it's healthy.